Good morning and welcome to this morning's webinar. My name is Daryl Moon and I'll be your host today. This is our first in a new series of webinars on workplace mental health and well-being best practices. As with our last series, these will be short 30-minute webinars brought to you by Going on Offense and sponsored by Resilience Pro. As we all know, the pandemic has heightened the need to address mental health. The uncertainty that we all face is having devastating effects on emotional well-being. This new series of webinars is being conducted to share best practices of supporting emotional well-being and mental health at the workplace. The Health Enhancement Research Organization, which I've been fond of for many, many years, has released a report on employee mental health and well-being, emerging best practices and case study examples. I am pleased to have with me as my guest panelist today, Nancy Spangler of Spangler and Associates, who was one of the contributors to this report. We will be reviewing the 6 best practices outlined in the report today. First of all, let me give Nancy a moment to introduce herself and to perhaps share with us how she got involved in working on this report with HERO. Nancy?
Thank you, Daryl. Good morning, everyone. I too have been fond of HERO for many, many years. It was one of the early organizations that brought wellness professionals together to look at the research supporting wellness back in the late 70s, early 80s. And I've had great respect for its leaders and its staff members and its employer and vendor members over the years. I've been pleased to present in their conferences and attend a think tank on mental health and to participate in a couple of committees, including the subcommittee on mental well-being, which is part of the work performance committee of HERO. The group that came together really sought to look at what is the data around best practices in workplace mental health. It was an interesting experience that I'll go into a little bit, but basically HERO's committees are volunteers who come together from various areas of practice and concerns, of common concerns, and many times there are white papers that are developed or other ways that these committees put forth something so that others can benefit from their work together. And this is an example.
Great. So why don't we just mention that if anyone is interested in, we'll be showing the report during the presentation, but we've also put it on your control box. So if you'd like to download the report during the webinar today, you're welcome to do that. Just simply go to the control box and download that. And while we're discussing, oh, go ahead, Nancy.
Well, another way is to actually access the website, which is called HERO, HERO health.org. The white paper is housed under the committee section, but the easiest way is just to go to the search bar and put in workplace mental health and well-being best practices, and it'll pull up the white paper.
Great. So let's jump in and talk a little bit about the report. Tell us, Nancy, first of all, what area of the report did you work on? Was it all of the report, or did you focus on a specific one of the 6 best practices that has been described?
So in the beginning, as I mentioned, we were looking at the research and trying to determine what suggested that there were best practices. And as it turned out, the research is in terms of outcomes specifically. And part of the reason I found over a period of many years in working with the American Psychiatric Association in raising awareness with employers and trying to find best practices, what were the ways that employers were approaching mental well-being and what kinds of outcomes were they looking at. The outcomes were so varied, and the research and data collection that some of the employers did um, was different. There was not a lot of consensus, and some employers were a little hesitant to share research that they had or data that they had collected on employee health status and change, even from an aggregate level. Of course, no individual data, but there is a stigma around sharing the level of mental ill health within an organization, um, in terms of what that says publicly about the organization. We've seen significant change over the last 20 years in that, however, and I'm encouraged that there is a trend now towards better collection of data around mental illness as well as mental health. I would really like to emphasize the difference in that. In the mental health treatment arena, we tend to look at deficits. We tend to wait until someone has a diagnosable illness and qualifies for health care for that diagnosis, or many employers have EAPs. But one of the purposes, I think, in this uh, group was to help look at what is mental well-being and what are employers doing in that regard. So as we collected these various um, examples of data, we decided, there are already a number of case examples out there. We considered doing some case examples. Other committees in HERO have done case examples of employers, but we realized there are really some good examples already written. What if we compiled some of the guidelines that are already out there about best practices, which also vary somewhat,
Mhm.
and B, pull together other organizations' examples of best practices. So that's what we ended up doing, and there were several of us who really dug in and came to consensus about, well, what are the 6 that we feel are represented by these guidelines, as well as the practices, the case examples that employers have shared with different organizations.
And did you
So
start
that's
with like 12 and then bring it
mhm,
down to 6? Did you wind up kind of consolidating some into 6 simple things?
yes, absolutely. And the process, uh, it was a great committee, a group of people who are extremely committed to moving mental well-being forward. So it was really a joy to talk with these professionals and work through what we felt represented the guidelines and the case examples well.
Nice.
So
So Nancy, take us through the 6 steps and we can take a few minutes and discuss each one. And I've got some questions, but take us through 1, 2, 3, 4, 5, 6, and let's talk about it.
sure. So in raising awareness, we felt let's put that number 1, because while mental health treatment, number 4, is often where employers go and want to be sure that they're providing coverage for mental health treatment and EAP services. I, Many of us on the team felt we would love for employers to be thinking about ways that they can address this much earlier than the need for
Yeah.
treatment. The raising awareness was a way to play up the employers who have really looked at this strategically and understood that stigma gets in the way of accessing care. And so, why not talk about it at a high level? So, many of the examples in the case studies are ones where leaders, CEOs, executives have taken the lead and talked about either their own mental health issues or a well-known person in their organization or just the topic in general. So that's one way that employers can really raise awareness. There are some really great examples of that in the case examples. and I'll talk about a few of those. Also, the idea of training managers. This has become very well known as well through mental health first aid. And
Yeah.
that's an excellent intensive program, and many organizations are choosing to go that route. We also highlighted some ways that manager training is being done in a much more brief but highly effective way in making those managers feel more comfortable about talking about mental health issues, and not necessarily, well, and what is highly recommended is that the managers not go into details about the mental health diagnosis itself, but rather to point out to the employee where work performance issues are suffering, because many times people who are struggling with mental illness don't know that others are noticing.
Yeah,
So
and the
manager training.
supervisors, they're often in a position to experience the results of that mental health symptom. They're the ones that are suffering because jobs aren't getting done, work's not being done, teams aren't working well together. And really the manager's in a wonderful position to be the catalyst that getting someone over the hurdle to take advantage of the resources. Just helping them make that phone call.
Absolutely. Yes, yes. And there are some really great examples of that. And I really see that as an area that will expand in the coming years. I think getting over the hurdle of executives thinking that it's okay to talk about mental health rather than feeling like we might be at risk if we do talk about mental health issues. Um,
Well, and Nancy, would you agree that the pandemic in some ways has made it okay to talk about? The fact that
Absolutely.
everyone is experiencing stress, everyone is experiencing emotional turmoil over the uncertainty that's in front of us. I think it's opened the door for people to have those conversations.
Absolutely. And I think it is being looked at. The stress aspect is often separate from mental illness, which I've never quite
Mhm.
understood that, having been in the stress management field since the 70s as well. I have struggled with why that isn't immediately accepted, that
Yeah,
there's really excellent neural research showing that stress can help trigger or contribute to anxiety and depression. And we have serious stress related disorders, trauma related disorders.
yeah,
Those are conditions considered mental illness. Mental illness isn't a mystery, it isn't something um, to be shuttered away.
right.
Many people experience it. So yes, it has brought that to the fore. So I think we're seeing a lot of innovative ways to help people address that. And the managers that are being very forthcoming and building in ways to process that and support people. It's really great to see that. It's an unfortunate silver lining of the COVID virus, but it is for our industry a silver lining, the attention that it's getting.
So let's talk about number two, manage the psychological risks. Talk a little
That's
bit about what risks can cause physical harm and psychological harm, and what does that look like? What does that harm look like?
Yes, I would like to point out that we are pulling from guidelines from other countries that have been leaders in this area: Canada, New Zealand, Australia, Great Britain. Um, there are guidelines in those countries that address workplace policies, processes, management processes that contribute to mental ill health. And those include things like lack of autonomy and contribution to decision making, lack of adequate skill training, lack of respect or bullying in the workplace. All of those things, lack of trust, lack of psychological safety. So all of those things contribute to the culture that can either support people in feeling okay in speaking up or not. And speaking up about work issues as well as speaking up if they are struggling with a mental health issue. So that psychological safety is a really important key factor, and trust is a driver of that.
And
So
when it's not there, what happens is the productivity, probably the most apparent result is that productivity suffers, not only of the
Right,
individual, but the people that work around them.
right. One of the components too is employee recognition.
Mhm.
Sometimes people say, well, now how is that a mental health issue? But when you think about the symptoms of anxiety and depression and the brain pathways that are overused in those conditions, we can counter that and develop new brain pathways by helping a person feel a sense of self efficacy, a sense of self worth, a sense of contribution to something bigger than themselves, a sense of purpose and drive, flow in their work, a sense of flourishing. We have great research around that. What has been somewhat missing is how does this translate on a day to day basis in managers as they develop their own teams and their own practices within their teams?
Yeah, I would only underline what you just said. You can't diminish the value and importance of people feeling valued and feeling like they're contributing, because that's an underlying foundation of productivity. If a person feels
Absolutely.
like they're a part of the mission of the company, they know their role within the vision of the company, and they feel like they're contributing to it and it's being recognized, that has a great deal to do with how they're feeling about
Right.
themselves.
Yes. The work-life integration is an area that's really gotten a lot of attention with COVID as well, because everybody's work-life roles are
In the
blurred.
beginning.
And at first, there was some concern that employers wanted to track to be sure people were spending enough time at their work. And now they're saying, oh, people are spending too much time. They need to have boundaries. We need to help them find ways of signaling the end of the workday when they might have been doing a commute back home, or having
Right.
some other way of signaling that. So that's an area that's gotten some attention too.
So let's talk about number 3, assess the needs and measure the impact.
So
Talk a
this
little
is
bit
an
about
area
what that looks
you
like.
know a lot about, Daryl. And as I said, I think we will see a lot of attention to this. When we look at mental health, employers often either assign that to their EAP or to their health plan, and they may get data back on what are the conditions we have, how many antidepressant prescriptions do we see. That's the end of the road, and
Yeah.
we need to have more attention to mental well-being. What does it mean to feel mentally well? How do we address that? And how can we help people understand that thoughts, emotions, and behaviors are the triad that is addressed in mental health treatment? Well, let's develop those skills earlier. Let's talk about that. Let's assess it. And so I do think that we will see much more about emotional health, mental well being, and absolutely we need to track mental illness too in terms of how does that change over time. I also think we see much more connection in how does mental health, thriving at work, contribute to work performance, engagement, employee retention, reducing presenteeism when you're present, but you're there, but you're not all there, and those kinds of measures, which
Yeah.
there's great research around.
Well, and I love how the report not only talks about the need to assess, but also regularly assess so that you're monitoring rather than just doing a
Yes.
once a year, here's where everybody is. I love the idea of the monitoring. Any examples that you can share with us about how you monitor on an ongoing basis the emotional well-being of populations?
Well, so one example is the Resilience Pro tracker that you have developed. Other companies have done things like uh, what are they called? Flash surveys, like everybody
Old
coming,
surveys.
pulse surveys, thank you.
Yes.
Everybody coming in the building, like a quick survey of how people are feeling, or what are the things they're thinking about that week, and ways of kind of connecting mood and And other examples are employers using health risk appraisals or health assessments, and then and as you do, having coaches that follow up with people periodically to proactively check in with them to see how they're doing on goals. We have
Yes.
established that for physical illness. I mean, there is no one today who doesn't think about a health coach for reducing cardiovascular disease or reducing diabetes. Well, hello, we we can address the skill set for mental well-being through coaching.
Right.
It absolutely is a growth area that has such potential.
Awesome. So number 4 is to promote evidence-based and high-quality mental health care. Talk a little bit about, how do you measure and evaluate something that's somewhat gray? It could
Yes,
boil down to the personality of the counselor. So how do you
right.
really measure quality evidence-based mental health care?
That's a really important issue, because even though many employers jump right to, okay, we provide EAP and we provide mental health coverage, the variance in the way those two services are provided
It's
is
huge.
huge, huge. For example, some of the case examples had internal EAP providers, so a panel of 10 providers, and obviously contracting with some external EAP providers where they don't have large uh, populations of employees in certain regions. But that internal management uh, was not even comparable to some employers who have EAP provided through a vendor, where it is upon the employee to access it. They may be assessed and then encouraged to call a provider, and they may have a wait list of 6 months, or they may not be able to get a response from the provider, or any number of things. It just absolutely, they're not comparing apples to oranges, apples to apples. The other thing about healthcare providers, people typically access primary care as a first line when they have symptoms that are actually mental health symptoms, but are being translated into pain
Right.
or to gastrointestinal disorders or headaches or any number of physical issues. And it's really the contributors of stress, anxiety, and depression are uncovered by the primary care physician. Primary care physicians are not well trained in mental health. It's not an area that has traditionally been included. And B, the first line is typically prescription. And there are so many other ways we can address mental health earlier. The other issue is that for coverage in terms of behavioral health, so seeing a psychologist or a psychiatrist or a social worker, in many cases, the panels are lacking under the health plans, and people may go outside of the health plan to access the the counselor that a friend used. And
Right.
so the person isn't getting the coverage that they actually have, but they're trying to solve it on their own. It's a mysterious process in many cases.
Well, and I guess to summarize, I think we need to point out that so often people with mental health symptoms don't reach out for help within 10 years. The average length of time is 10 years. So there's a huge gap right there. And then there's 60% of the people who never reach out for help. So
Right.
there's a huge gap in itself. And then there's
Yes.
the over 50% who reach out for help who fall through the cracks. So,
Right.
I mean, it's
Yes.
one thing to say once you get into mental health care, it's really important that you get good quality care. But let's not forget the fact that there's a lot of people who need help that aren't getting help or who are falling through the
Right.
cracks.
Yes, and many people say, I would rather talk to a coach than a
Yeah,
psychologist. So
yeah,
why
because
not
of the stigma.
implement the coaches who can help reduce barriers to care, more advanced
Right.
care, when that's appropriate for a person to address
And
those
there are
thoughts?
actually a lot of companies that are in the CAP space that have actually expanded to include both coaching, mental health or behavioral health coaching,
Mhm.
as well as mental health professional licensed counselors. So that's becoming a
Yes.
trend, and it's good to see that because there is value in having both.
Yes. And another trend is healthcare navigators, behavioral healthcare navigators.
Yes.
So helping people rather than putting it upon them to the list of 6 psychologists that are in their plan, helping them make the call, helping them
Right.
select a therapist that might be most appropriate based on their expertise that they've expressed. So
Well, and then
it's
there's
an
good
important area
examples.
for sure.
We talked about the NUCA healthcare system, where the entire primary care system is behavioral focused. Everyone on the panel, the doctor,
Yes.
the nurses, the social workers, the physical therapists, the coaches, everybody, their value proposition is to engage change and to help
Yes.
someone get the help they need to address those internal challenges and emotional issues. So there are some wonderful examples of where medical model has understood how valuable and important it is to address the mental health.
Yes. And the NUCA example shows how important relationships are,
Yes,
because the biggest barrier for a person accessing mental health care is that they typically don't have a relationship
right.
set up, and that is really difficult to share your deepest darkest secrets
To a
with
stranger.
someone that you don't even know.
Yeah,
So
yeah,
it takes
yeah,
years of
totally
trust
agree.
sometimes, which
So
is
let's
another
talk a
reason
little bit.
why people often go to their primary health care provider, because they at least do have a relationship with that person typically.
So we have about 4 more minutes. We're going to try to keep these to about 30 minutes. Talk a little bit about both the need to integrate mental health and well-being into a integrated, comprehensive wellness program, as well as the need to share best practices with others.
Yes, I love the trend. So back in the 70s, we looked at holistic health, but somewhere over the years hence, we focused a whole lot, sort of a medical model on physical well-being, so exercise and diet primarily. So I really love the return back to a more holistic approach, and emotional health is just one piece of it. Financial health, which often contributes to emotional ill health,
Definitely.
and the whole aspect of looking at the total person, and again ways of coaching and identifying, and over time helping people realize that these all contribute to one another. And the physical interventions are showing, the research in that area. Walking, another silver lining of the COVID virus. I see families out walking together now, and many of those kids are getting
Yeah.
much greater role models through their parents than being dropped off at a sports practice. It's
Mhm.
just a great bonding activity. So that's an area where I think we'll see a lot of growth, as well as assessments help draw these areas of well-being together.
Well, and maybe talk a little bit as we just have a couple of minutes left. How can best practices best be shared? What are, I mean, heroes an example,
So
but what are some examples, other
yes.
examples of how to share best
Well,
practices?
yeah, so that actually leads us to number 6, which is partnering with local and national organizations. Some of those are listed. So I think it's on page 14, or 16, it's page 16, that is a reference table that has a summary of the case examples that we reviewed and the best practice number that corresponds to that. All of these examples are just excellent ways of looking at how employers could be addressing mental health differently. And there are some resources that are being shared. For example, the American Psychiatric Association's website, workplacementalhealth.org, houses many of these case examples that over a period of 16 years I helped them develop. And there are just great resources that some are giving away. Tier 1 is one that's on that list. Another is DuPont, which we didn't include in this review, but they donated a video that they did across the world, and it's translated into several languages, and that's available on the workplacementalhealth.org site. And there are other organizations in cities where employers, they just don't have a relation with that behavioral health group that may provide emergency services to their employees or help for someone who may all of a sudden be homeless because of a financial issue. So we really encourage people to look locally and nationally and use the resources that are available for free.
Wonderful. Nancy, we're out of time, so I'm going to go ahead and conclude our webinar, but thank you so much for your contribution. Let me remind the attendees that Resilience Pro is the sponsor of this series of webinars, and a brochure describing that solution is available to download through your control box. Today's webinar is the first in this new series of workplace mental health and well-being best practices. We will be diving deeper into each of these best practices over the next few weeks. Next week's webinar will be on enhancing mental health awareness at work. Please join me next Wednesday, October 7th at 9 o'clock Mountain Time. As a reminder, the recordings of all of these webinars can be found on goingonoffense.com. The website contains a host of other ideas, suggestions, resources, and helps for organizations that want to provide emotional well-being support to their employees during these difficult times. We suggest you check them out. Again, thank you so much, Nancy.
Thank you, Daryl, and thank you to Hero.
Yep, thank you very much, and have a wonderful day.
Thanks, you too. Bye-bye.